Hi, my name is Karen. I'm going to be your nurse today. How are you today?
I'm good.
And are you in any pain? Are you having any sensations?
Nope.
Okay, good. I'm going to check your bracelet. Can you tell me your name and date of birth?
Todd McGowan, 7793.
Good. And do you know where you're at today?
I'm at the hospital.
Okay, and what season is it?
It's fall.
Good. And it's nice and pretty outside. The weather's good. So hopefully we might be able to take you outside. Do you care if I go ahead and I check you over today?
Go ahead.
Okay. I'm going to start by looking at your eyes. I'm going to check your pupil reactivity on both sides, make sure it's nice and normal. Okay. Okay, good. And can I have you open your mouth for me? I'm going to check your mucous membranes, make sure they're moist and nice and pink, and they are, which is good. Now I'm going to assess your hearing in your ears on both sides. I'm going to whisper 2 words in your ears to make sure that you're able to hear on both sides.
All right. A pink cat
Good.
and a yellow pig.
Good, okay. Now I'm going to check your vein distension in your neck, make sure jugulars are normal, so I'll have you look towards the wall for me. Good, and now look back towards me. Okay, good, and that seems to be good. Now if you don't care, I'm going to go ahead and I'm going to listen to your lungs.
Okay.
Every time I move the stethoscope, I'm going to have you just take a deep breath for me, okay?
Okay.
Okay. Okay. Okay. Okay. Okay. Okay, and if you don't care, I'm going to check the sides.
Okay.
Okay. Okay. And I'm going to listen from the back. If you can just lean forward for me. Good. Okay. Good. You can lean back for me. Okay. Now I'm going to listen to your heart. Okay. And I would do this totally for a full minute, but I'm not going to do it for a full minute this time. Okay. Seems to be nice. Now I'm going to assess your arms. I'm going to look for any skin breakdown, any red marks. Okay. Okay. And I see that you have an IV. Is it causing you any discomfort, any pain?
No, it's all good.
Okay, good. Now I'm going to do the same for your hands. Going to look for any swelling in the hands, any skin breakdown. And I don't see any. Assess the hair growth of the fingers, and those look to be good. Now I'm going to press in your nail beds. They seem to go back pretty well, which is good. Okay. Now can I have you squeeze my fingers? Good. And now we'll do this side. Good. Okay. Now I'm going to listen to your stomach. Good. Everything appears to sound normal. And if you don't care, when was your last bowel movement?
Last night.
Okay, that's pretty good. And are you having any trouble voiding?
No.
Okay. What about any frequency or pain with urination?
All good.
Okay. Looks to be good. Now, if you don't care, I'm going to check your legs. I'm going to pull this down. Okay, now if I can have you bend the knee for me. Okay. We'll check for any redness, any skin breakdown, any edema in the legs, and I don't see any. Put this down back down. I'm going to assess the gauze. The gauze looks to be nice and intact and dry. It doesn't need to be changed right now, so I'll go ahead and I'll leave that. Have you do the other side for me. Good. Check the skin breakdown. Any redness in this? I don't see any, which is good. Okay. Now I would lower the bed, and if you can face towards the wall for me, I would assess the back for any skin breakdown. And I don't see any. Okay. You can go ahead and move back for me. Okay. Now I would assess the ankles, look for any edema, and I don't see any. Look at the toes. He does have hair growth in the toes. That's good for oxygen. Oxygen is going to the feet. His toes look to be pretty normal in color. Okay, now I'm going to check the pulse in your feet. Okay, now if I can have you push against my hands, almost like you're driving a car. Okay, good. Are your feet cold? Do you need any socks today?
I'm good, I think.
Okay, and I'm just going to double check your radial pulse. Okay, looks to be strong and reactive in both sides, which is good. Is there anything else you need from me today?
I think I'm good.
Okay. We are having lunch soon, so hopefully they should be bringing that in to you. If you need me, don't hesitate to call. Go ahead and I'll leave this call out for you, and just let me know if you need anything, okay?
All right.
All right, I'll be back to check on you in a bit.
Thank you.
Thank you.